Here are some signs that you should take a pregnancy test. Number 1. You've missed your period. One of the first and most reliable signs that you are pregnant is a missed period. If your cycle isn't tracked closely, it might be hard to determine whether or not you're late with tracking. However, many women have 28-day cycles, so consider taking an at-home pregnancy test if more than 2 months has passed since last having any sort of bleeding accordingly. Keep in mind this can happen due to stressful levels as well diet, exercise, etc. too. Number 2. You have cramps. Implantation can also produce a similar feeling to menstrual cramps. In early pregnancy, you may feel this discomfort and think your period is just around the corner only for it never to come again after implantation even if before that time frame has passed. So take some tests. Number 3. Your breasts hurt. Pregnancy causes changes in the body that support baby's growth. These can lead to tender breasts which appear bigger because there's an increase in blood flow, as well increased sensitivity from engorged tissue due also to dilation when pregnant women get their period, but not always indicative if you're actually expecting something, since many will experience similar symptoms before even realizing they are pregnant again, just like how we all do each time this happens without being aware why exactly those changes occur. Number 4. Your contraception failed. There are many things that can go wrong with birth control. A person's positive pregnancy test may be due to forgetting pills or having a defective device such as an oral contraceptive pill time clock, which happens 9 times out of 100 women, or 1 in 10. The best time of the day to take a pregnancy test. Taking a pregnancy test is an important decision that should be made with care. The best time to take one depends on when your next period will be, but also keep in mind not get too excited until you have at least 3 days worth of vaginal discharge from all 4 corners, yes, even upside down. If this doesn't happen by day 5, then definitely wait another 3 to 4 days before taking anything into the glorious little universe we call home. Is it okay to take a pregnancy test after intercourse? The answer to the question of whether it is safe to take a pregnancy test after intercourse depends upon when in your menstrual cycle you have intercourse. If you have had unprotected intercourse just before or at the time that ovulation was expected, then it may be possible that fertilization has already occurred and testing too soon might give an incorrect result. On the other hand, if you have had intercourse more than 5 days before ovulation, there is no chance that you will be pregnant. Can you take a pregnancy test during implantation bleeding? You can take a home pregnancy test during implantation bleeding. Pregnancy tests are a great way to know if you're pregnant as soon as possible. Taking one during implantation bleeding will give more accurate readings since the hormone human chorionic gonadotropin, or HCG, starts being produced only on day 1 of your missed period and triggers for when to start looking into purchasing those types. The sooner it's taken after fertilization has occurred, meaning right away any spotting or redness begins, then there'll be greater accuracy in determining whether someone may already have been PG. Because their levels rise so quickly over time. Can you take a pregnancy test on your period? Yes, you can take a pregnancy test while bleeding or seemingly on your period, because any blood that mixes with urine will not affect the results of this type of home testing kit. However, keep in mind that typically periods have been shown to be reliable signs for women who are pregnant and trying unsuccessfully times their monthly cycle. So, it's worth checking out if you're experiencing unusual abdominal configurations like cramping, backache signals, hormones. Why take a pregnancy test after a miscarriage? In the past, it was thought that getting pregnant within 3 to 6 months of a miscarriage raised your risk for problems like toxemia and stillbirth. However, recent research does not support waiting so long as you start trying again soon after losing an infant, and in fact studies suggest there's greater chance of pregnancy if conceived within this short time frame anyway.